Hi everyone, it's Paul. We're just going to look at one quick case of granuloma in a lymph node. This case is a 67-year-old male who was having the procedure performed as part of lung cancer staging. So we want to sample the nodes that run up the mediastinum, up the hilar area, and a method that's used for that is transbronchial endoscopic ultrasound guided FNA. So the needle is passed down through the bronchus and then in between the cartilage rings of the bronchus into the lymph nodes. And radiologically, granulomas often mimic cancer. So the question often is this a metastasis, which would put the patient into a higher stage for lung cancer, perhaps a different treatment, or is this in fact something benign? And the most common benign thing is a granuloma. Low power, you can see a mass of sort of cells there, maybe lymphoid cells in the background, but a very disorganized group. And on high power, you can see that many of those nuclei are showing sort of a footprint shape like that, like a thong. They're elongate, they're showing really no organization in that group, certainly no polarity. And some of them look a little spindled almost. They have kind of vague cytoplasm that would fit with a histiocytic macrophage. These cells here are ciliated bronchial epithelial cells that are a contaminant, more or less. They've been sampled on the way through the bronchus, so you have to be wary not to overinterpret those. There's quite a lot of lymphoid cells in the background. This is a big mass of ciliated bronchial epithelial cells. You can see the cilia running along here and the sort of pseudo-stratified strip of columnar epithelial cells present there. Here's another little mass of epithelioid cells. They're showing that typical indistinct cytoplasm, elongate nuclei, roughly overlapping, some quite elongate nuclei in this little group. Background, scattered lymphoid cells. So in summary, what we see with granuloma is epithelioid histiocytes arranged in very disorganized loose groups showing no polarity. They have elongate nuclei, often that are in like a footprint sort of shape. You will, in a lymph node, certainly see lymphocytes in the background. You won't always see those in granulomas. And often you'll see multinucleate histiocytes present as well. This case showed contaminant bronchial epithelial cells, and that's always a problem area in EBUS or indeed in any endobronchial ultrasound guided